Since before World War II, Japan has developed policy frameworks surrounding the first 1,000 days of life. This presentation aims to show how nutrition campaigns for mothers and children are implemented by health administrations throughout Japan. Furthermore, by examining the specific frameworks used by actual public officials, we hope to provide some insight into the implementation of new maternal and child nutrition services. This presentation introduces nutritional policies for mothers and children from 5 perspectives. Let's start by outline of support system for mothers and children. Japan is seeking to create a society in which all mothers can give birth to a child safely and securely, and in which all children can grow up soundly and healthily. To that end, universal and seamless support is provided by the country for every expectant and postpartum mother, without exception, covering the period from pregnancy to child raising. This support can mainly be found at each community's comprehensive support center for child raising. From here, we will introduce Japan's administrative measures for maternal and child nutrition. Healthy Parents and Children 21 serves as the basis of administrative measures for maternal and child health in Japan. Healthy Parents and Children 21 is a national campaign designed to enable all concerned parties to work together on initiatives for improving the health level of mothers and children. In order to achieve a society in which all children grow healthily, 3 basic issues and 2 priority issues are set out. Specific measures taken to tackle those issues include health checkups for infants and toddlers, vaccinations, mentoring for parents, and dietary education called shokuiku. In Japan, upon getting pregnant, women notify their municipal government of the pregnancy and are issued a maternal and child health handbook. Pregnant women are entitled to 14 free prenatal checkups at hospitals, clinics, or midwife facilities. They can receive support on diet and nutrition through participating in mothers and parents classes and home visit services by public health nurses and midwives. After childbirth, mothers are entitled to newborn home visit services and house call services for all households with babies. They also have access to age-specific nutrition support at children's health checkups at the ages of 18 months and 3 years, as well as some other occasions. The Maternal and Child Health Act calls for pregnant women to promptly notify their local government of their pregnancy. From there, the local governing body will issue a maternal and child health handbook to these women. The Maternal and Child Health Handbook was created around 1948 in Japan as a tool to protect the health of mothers and children. The handbook enables the mother to more easily manage the various health services she has received with her child across different facilities and with different specialists. In other words, the Maternal and Child Health Handbook is designed to ensure seamless and constant care from pregnancy to childbirth and through the child's development. In addition to the required information specified by the Ministry of Health, Labor, and Welfare, the handbook covers other information added by each municipal government at its discretion. The Maternal and Child Health Handbook is the first gift from the public administration to women who have decided to give birth to a child, and it has been cherished by many mothers as a token of the child's growth and her bond with them. The dietary guidelines for expectant and postpartum mothers consists of 9 items regarding nutrients, dietary content, lifestyle, and the physical and mental health needed by pregnant women. The guidelines are intended for use by both mothers and healthcare professionals. The guidelines are expected to more widely promulgate the importance of having an appropriate diet, not only during pregnancy and in the postpartum period, but also before getting pregnant. The Food Guide for Expectant and Postpartum Mothers is based on the dietary guidelines for expectant and postpartum mothers. The food guide shows what food, how much of it, and in what combinations it should ideally be eaten for expectant and postpartum mothers each day. The guide shows the recommended daily intake of staple foods, side dishes, main dishes, milk or dairy products, and fruits, according to maternal stages, such as non-pregnancy, early to late pregnancy, and breastfeeding. Support is provided not only for those who use government services, but also for those who provide such services. The Guide for Supporting Lactation and Weaning is designed for use by healthcare professionals. This guide was developed so that all those who work with expectant and postpartum mothers or children have common basic knowledge. To that end, the guide has been used mainly by municipalities and hospitals. The guide mainly covers the current situation of mothers and the tendency of lactation and weaning, ways to support lactation, such as when to start lactation and how to establish a lactation rhythm, and ways to support weaning, such as when to start and proceed with weaning, and information about complementary food and how to cook it. In order to provide mothers, babies, and their families with effective support for lactation and weaning, it is essential that various organizations in the community are in contact and work together with one another. This includes the municipal health centers, the public health centers, child care centers, maternity hospitals, pediatric hospitals, and the Comprehensive Support Center for Child Raising. For consistent and constant support covering the period from pregnancy until the completion of weaning, it is equally important that healthcare professionals, such as doctors, public health nurses, and registered dietitians and dietitians, share basic information about lactation and weaning. Expectant mothers receive guidance and support regarding the following 4 matters when they go through health checkups: body weight control, preventive measures for anemia, pregnancy-induced hypertension, and gestational diabetes. In addition, regarding lactation, Japan provides guidance and support separately from the pregnancy period as well. Based on the body weight measured at health checkups, expectant mothers receive guidance and support on diet and nutrition. The ideal weight gain during pregnancy for both mother and child depends on the mother's pre-pregnancy physical condition. Recommended weight gain over the entire course of pregnancy is 9 to 12 kilograms for those described as underweight before pregnancy, while for those whose pre-pregnancy weight is considered in the normal range, it is 7 to 12 kilograms. For those categorized as overweight before their pregnancy, the recommended weight gain is determined individually. Recommended weekly weight gain during the mid to late pregnancy period is also specified. Weight gain, however, can differ substantially from person to person, so it is necessary to pay individual attention to each mother's diet and physical activities, and not to blindly pursue the recommended weight gain amount. In health checkups for expectant mothers, the following 5 pieces of guidance are provided as preventive measures for anemia. The following 6 pieces of guidance are provided as recommendations for pregnancy-induced hypertension during pregnancy and the postpartum period. The following 6 pieces of guidance are provided as dietary therapy points for gestational diabetes. For those beginning to breastfeed and establishing a lactation, the following serve as an important support points. Provide support so mothers will be able to stay together with their newborn babies all day until they leave the hospital. Provide support so mothers can breastfeed whenever needed, whether it's to accommodate the needs of the hungry baby or the lactating mother. Have a good grasp of the condition of both mother and baby. Accept the mother's feelings and emotions, and help her so that she will not feel rushed to establish a lactation rhythm. From here, we will introduce dietary guidance and support for infants. In health checkups for infants and toddlers, the child's height and weight are measured, and then the measurements are input in the children's growth curve chart to help measure the child's physical development. The children's growth curve is updated based on the results of a nationwide survey on the physical growth of infants and toddlers that is conducted by the Ministry of Health, Labor, and Welfare every 10 years. The Children's Growth Curve Chart is also found in the Maternal and Child Health Handbook, allowing the mother to enter and check her child's height and weight on a monthly basis by herself. In the Children's Growth Curve Chart, you can also find information about children's general development of physical skills. The Guide for Supporting Lactation and Weaning also shows the general eruption time of teeth and the development of eating skills, apart from advice and suggestions on diet habits, food preparation, and recommended food amounts for each meal. These are all shown separately for separate age groups. Early weaning at 5 to 6 months, mid-weaning at 7 to 8 months, late weaning at 9 to 11 months, and post-weaning at 12 to 18 months. All such information is also provided in the Maternal and Child Health Handbook. According to the guide, it's good to start with a spoonful of mashed cereal, vegetables, or fruit once a day for babies aged 5 to 6 months who are in early weaning and have just started acquiring the skills of keeping food in their mouth and swallowing. For those aged 7 to 8 months who are in mid-weaning and have their first baby teeth, they are likely acquiring the skill of crushing food with their tongue and jaw. The guide instructs that at this age, children should be fed twice a day so they get accustomed to eating regularly, and that the kinds of food they eat should be increased. The guide recommends that the amount of intake per meal for these children should be 50 to 80 grams of porridge, cooked at a 1:5 ratio of rice to water, 20 to 30 grams of vegetables and fruits. As a source of protein, children can be given one of the 4 following items: 10 to 15 grams of fish meat, 30 to 40 grams of tofu, 1 egg yolk or 1/3 of a whole egg, or 50 to 70 grams of a dairy product. The guide says that those aged 9 to 11 months and late weaning should be fed 3 meals a day, and that they should eat food that can be crushed with their gums. For those aged 12 to 18 months who are in after weaning, the guide recommends that they should eat food that can be chewed with their teeth and gums, and that they should acquire the habit of eating 3 meals a day at a regular daily life rhythm. Concerning nutrition, diet, and dental care, certain points are specified by the Ministry of Health, Labor, and Welfare to be checked in health checkups for infants and toddlers. Specifically focusing on children's physical development, lactation and weaning, meals and diet, as well as teeth and oral functions, the ministry requests certain points to be checked over the 5 health checkups that children receive in early life. These are undertaken when they are in the newborn period, aged 1 month, in the early infancy period, aged 3 to 4 months, in the late infancy period, aged 9 to 10 months, in the early toddler period, aged 18 months, and in the late toddler period, aged 3 years. Lastly, we will introduce examples of maternal and child nutrition support. The Maternal and Child Health Act requires prefectural and municipal governments to provide individual or group consultations and necessary advice about pregnancy, childbirth, and child raising in order to maintain and improve the health of mothers, infants, and toddlers. These governments must also make efforts to spread knowledge about maternal and child health by supporting resident activities and other initiatives. Classes for mothers and parents are organized by public health centers, municipal health centers, comprehensive support centers for child raising, and medical institutions. The choice of class themes is left to the discretion of organizers. However, it is often the case that mothers' classes are held for the purpose of providing pregnant women with information about childbirth and child raising, and thereby alleviating their concerns. Meanwhile, parents' classes are held for the purpose of giving fathers important pieces of advice, such as what considerations they should give to their pregnant partners, how to take care of newborn babies, and how to raise children. In Saku City in Nagano Prefecture, classes on nutrition, based on the Balanced Diet Guide for expectant and postpartum mothers, are made available to expectant parents so they can learn about what foods they should eat during pregnancy and potential menus for pregnancy and parental life. Newborn home visits by public health nurses is a public service based on the Maternal and Child Health Act. A midwife or public health nurse pays a visit to the home of a newborn who is within 28 days after birth and checks the health and nutrition of the mother and the child, as well as their domestic circumstances, and gives them individually tailored guidance and support. In the house call services for all households with babies, certain third parties visit basically all households with babies up to 4 months old to listen to their concerns and problems on child raising. This helps to prevent families from growing isolated due to child raising, and also provides them with information about child raising support services that are available. House call services for all households with babies are also aimed at creating a community in which all children have access to a sound and healthy upbringing by providing targeted support for families who need it. Complementary feeding classes are lectures on diet and nutrition, mainly held for parents of infants and toddlers at public health centers and municipal health centers. It is often the case that parents must apply to take part in complementary feeding classes, and they are typically organized according to children's age. Participants learn what kinds of foods and cooking preparations are suitable for children of their child's age by actually cooking and tasting them. In Saku City in Nagano Prefecture, complementary feeding classes are held for parents with pre-weaning children aged 5 to 6 months, and for those with children in mid-weaning aged 7 to 8 months. In those classes, participants start by cooking miso soup for adults so they can learn how to adjust it to complementary food. They learn how to measure the salt concentration in food and why it is important to avoid using too much salt in complementary food and home meals. In the complementary feeding classes for parents with mid-weaning children, participants taste food prepared by dietitians and healthmates. This gives a first-hand experience about how food portions influence babies' mouth movements. Questionnaire surveys are also conducted to cover topics of interest concerning complementary feeding, such as what and when to introduce new food for the child. Early pregnancy is a critical period for the health of the mother and child. However, women in early pregnancy tend to come across difficulties, such as not being able to find an unoccupied seat in a crowded bus because their pregnancy is not apparent to others. For the purpose of ensuring safe and comfortable pregnancy and childbirth, the Promotion Committee for Healthy Parents and Children 21 made a logo named the Maternity Mark. The maternity mark, authorized by the Ministry of Health, Labor, and Welfare, is designed to be worn by a pregnant woman when using public transportation or in other similar situations so that others can tell that she is pregnant. As you have learned, various kinds of supports and initiatives on health and nutrition have been implemented in Japan to foster a social environment that cares about the health of mothers and children.